Now coming on to the most controversial drug in male pattern hair loss, that is finasteride. We all know it works. It is a 5-alpha reductase type 2 inhibitor which helps in reducing serum DHT levels as well as scalp DHT levels. Thereby it works on the pathogenesis of male pattern hair loss and it helps to improve hair thickness and hair volume. It works better on the mid scalp and the vertex hair than the hairline, and works better if it started at a younger age than at the older age. To get its maximum benefit and to see its maximum result, it has to be continued for at least 12 months. And once we stop oral minoxidil, the efficacy and the results start to drop down. But here comes the problem that many patients come to you saying that they have read about it, that finasteride causes sexual side effects, whether it is safe to take finasteride or not. And that leads to all the problems, because if we don't answer them properly, we cannot prescribe it. So it is proven that finasteride does lead to a reduction in the ejaculatory volume. That mainly happens because of reduction in DHT levels at the level of prostate as well. Other sexual side effects which are reported are erectile dysfunction followed by ejaculatory dysfunction and loss of libido. These side effects, if reported, will occur at early stage of the therapy, and they return to normal on stoppage of therapy and even despite continuation of therapy. I will highlight further whether finasteride actually caused it or not, but even if they are reported, they are rarely persistent. Then again, it can also lead to some changes in the DNA or sperm motility, which happens in less than 2% of the cases, but it never disturbs a meiotic pattern. So if a couple is planning pregnancy, it can be given, but if they are already suffering from infertility, then we should refrain from prescribing finasteride. Excretion of finasteride in semen is very less and it does not affect the fetus. So we don't need to stop finasteride if they are planning pregnancy or the partner is already pregnant. Now the drug related side effects like decreased libido, erectile dysfunction, ejaculatory disorders, they occur in less than 2% of the men. And these side effects may disappear while the patient is on therapy, and it has been seen that by the 5th year, these side effects, the incidence drops down to less than 0.3%. Also, they were comparable to placebo. So it was also postulated that these side effects can be related to nocebo effect. There is a proper meta-analysis in which the patients were prescribed sugar tablet and they were told that they can develop these sexual side effects because this is finasteride, and despite those sugar tablet, those patients who reported sexual side effects with finasteride, they continued to report it with sugar tablet. So that study had concluded it's a nocebo side effect, but the persistence of sexual dysfunction, which is the main problem and the main apprehension of the patient, that's a rare event. And a proper study is needed to prove the true causal relationship, because there is a high incidence of sexual dysfunction in general population also, and patients of androgenetic alopecia, they already have body dysmorphic disorders and depression, so they may already be suffering from erectile dysfunction. So before prescribing finasteride, it's always recommended that first of all tell the patient yourself that these are some things which you're going to find on the internet, these are some things which people will tell you, and if they're already suffering from oligospermia, erectile dysfunction, depression, then you should refrain from prescribing finasteride. It should be the patient's choice after giving an informed decision. That you will find literature related to finasteride in which these side effects have been reported, though those studies were at higher dosage, and in male pattern hair loss we are giving finasteride as a very low dose, which is 1 mg once a day, which can further be reduced to 1 mg alternate day without hampering the efficacy, and only after informed decision it's good to prescribe finasteride. To solve these problems which are related with oral finasteride, topical finasteride is also available now, which comes in combination with minoxidil as well as standalone in 0.1% and 0.25% formulation. So this reduces scalp DHT levels considerably, and the reduction with 0.25% was comparable with oral finasteride. Also, the results which are achieved with oral finasteride can be maintained with topical finasteride. So topical finasteride is a good pick in these conditions because patients are more comfortable taking topical therapy and the sexual side effects have not been reported with it. The another molecule which is coming in limelight is dutasteride. It has yet not received US FDA approval but is approved in many countries for treatment of male pattern hair loss and is prescribed at a dose of 0.5 mg per day. Since it is a non-selective blocker, it is more potent than finasteride and it causes clinically more effective, as well as in patients in whom you have already prescribed finasteride and there is a stagnation of result, they can be given dutasteride to further increase the efficacy. Now we also have more oral minoxidil available. So patients who have a diffuse thinning in which the frontal as well as the occipital area is thinning out, or patients who are not able to use topical minoxidil due to any reason can be prescribed oral minoxidil, starting at a dose of 0.25 mg and gradually increased up to 5 mg per day. But we have to be cautious while prescribing oral minoxidil. It should not be used in a patient with cardiac disease, as it can lead to tachycardia, dizziness, pretibial edema. And in females, if you are prescribing oral minoxidil, beware that it can lead to hypertrichosis in the body. Otherwise, it's a good molecule, but it should not be used right and left. It should be used caution in selected patients.